So I use a strategy when I'm actually changing my gear from open-ended questions to closed-ended questions. I use a transition statement. I don't want to tell the patient that I'm going to bombard the patient with multiple closed-ended questions. So what I do is I use a transition statement, something like this. After I ask my open-ended questions and the patient tells everything, once I get all the information that is important to me, I use a transition statement saying like, Mr. Smith or Mr. X. X is the name of the patient. I would like to ask you few questions which I ask all my patients with symptom Y. Is that okay with you? For example, Mr. Smith, I would like to ask you few questions which I ask all my patients with chest pain. Is that okay with you? Mr. Mr. A, I would like to ask you few questions which I ask all my patients with cough. Is that okay with you? Sandra, I would like to ask you few questions which I ask all my patients with tummy pain. Is that okay with you? When you use this transition, you're telling the patient that now you're going to bombard them with multiple closed-ended questions, and the patient is aware that now you're going to ask them closed-ended questions, and they are not worried about why is this doctor asking me all these questions. Sometimes, if you don't use the transition statement, the patient gets worried and he will ask you, Doctor, why are you asking about cancer? Doctor, why are you asking about fever? That will stop your flow. So make sure you use the transition statements. That way you are reassuring the patient that this is something you're going to ask all the patients with this symptom. If you would like to know more about my OSCE mastery coaching system on the 5 pillars to pass your clinical exam and be a successful clinician, make sure you look for a link under this video or link in the bio, and I'm going to teach you how you can master the clinical exams, pass the exam successfully. I'm going to show you the whole system and also teach you how you can be a confident clinician. I wish you all the best, and I will see you in that video.